but you're doing it in a day that seems to be recording a number of historical facts in our country. So this, in addition to this work that you're doing today, note what else is going on around the nation. But before I begin, let me just say a really huge thank you to um, student government, student council for their work in this and putting this and working collectively and collaboratively with Dr. Arbello, Dr. Bravo, the entire student affairs department. You know, I have spoken and I continue to speak about how well we are engaging in this pandemic time, how well we have kept the community together. And, you know, that to me it was a surprise, but it's also a true wonderful outcome of the circumstances that we are currently living under. Uh, we at every It seems like Dr. Arbello has been with her staff, her incredible staff, have been pushing the envelope as to what's next, what more can we do, how can we bring everyone together. And so I am pleased about that. I am thrilled about it. I'm glad that we are remaining as a community together. And today is a good testimony to that. Today, with the student council, we're seeing this tremendous exercise, intellectual exercise. I want to thank all of the presenters. I saw we have quite a list of them. And I read some of the titles, very impressive work. I also got to say a big thank you to the faculty for their guidance and support and mentorship of you, future scholars, future practitioners. Without our dedicated faculty, a lot of times we wouldn't be able to do this type of work. So thank you so much to the faculty. And I asked Dr. Bravo to make sure that we invite the faculty so they can see the others who are not working alongside of you. They can see, what they have produced, this tremendous intellectual work that you have now contributing to your respective fields. So I can go on for another 2 hours, but I can always tell when Dr. Arbello know she wants to cut me off. So so let me thank again. I want to thank all of the presenters. I want to thank you for taking the time to embark on this during this period. It's not easy to produce intellectual work. It's not easy to convey that to your colleagues. And it's not easy to get up on a Saturday midday when the weather seems to be gorgeous and engage in this discussion. So thank you all. I'm really proud of every single one of you. I'm thankful that we have student council and student affairs that can bridge the digital divide and bring us all together. So I'm going to stop now, and I'll let my good colleague, Dr. Bravo, say a few words, and I will turn my mic off, Dr. Arbello. Would that please you this Saturday?
Thank you, Dr. Deepu, for those words. We know that Dr. Bravo wants to say some words as well.
Yes, good afternoon, everyone. And I echo Dr. Deepu's words that this is an event that I know that you have been pushing the envelope to have for quite a while. And I know that the pandemic did not help with that endeavor. Your ability to gather, to maybe present in the multi-purpose room, to do so many different things in person that you may have wanted to do. And despite that, you persevered, you persisted, and you moved forward. I'm Dr. Irene Bravo. For those of you who don't know me, I'm the Dean of Academic Affairs. And I am pleased to tell you that I was responsible in part for the ratings of your proposals. So the way that we did it, Dr. Arbelo asked me to say a few words of how we did it. We identified faculty in the area of expertise related to the posters that you forwarded. So these faculty experts rated your proposals blindly to other proposals. They just rated one or two proposals. Once that we finished with the first group of raters, we asked the second group of raters to blindly also look at those proposals and give us another rating so that we could have some support for the original information that we received and the original scores. So we did that, and then we submitted everything in a table format, including the ratings of the first reviewer, the second reviewer, the average, and ranked your proposals according to those scores. So that was simple. I tried to do inter-rater reliability, but by dimension, but that was very difficult to do. I did enter it in SPSS, but it did not. It did not really with the number that we had. It kind of grouped the 9, and so we were not able to obtain the inter-rater reliability, but we did get the average of each proposal. I would like to just finish by thanking Rita Rivera, Denise Carvalho, and the Student Council, as well as Liliana Martinez and Dr. Floralba Arbelo for putting in this together. I know that she has been doing a lot of things for students, and we're very, very grateful for your work, Dr. Arbelo. And just to remind you that research involves a sense of wonder, a sense of curiosity. Sometimes we say, oh, research is so dull. I don't like research. I like mental health counseling. I like this and that. But research is actually to investigate, to know the truth, or at least an approximate of the truth. And I commend you for having that attitude and also for your persistence during this process. It's wonderful, and I'm very, very happy for you. So congratulations to you all. And that's all for me. Thank you.
Thank you, Dr. Bravo. Thank you for those kind words. Yeah, on behalf of Student Council, we want to welcome students, faculty members, friends, families who are joining us. Thank you for joining us today. We are, Student Council, are proud to be sponsoring the Albizu University's Virtual Research Symposium, along with the Office of Students Affairs. From the beginning of this academic year, the main goal for Student Council has been to support student success. And we know that from a purely educational standpoint, there's no better way for students to learn research than by doing research. For the past months, the Student Council members have been collaborating on different initiatives, including hosting workshops and webinars on the process of conducting research. And our goal was to provide and equip students with the necessary resources and tools to complete their own research projects. Research experiences are important because they help students better understand the field of study, and research can also help shape a student's whole career trajectory, motivating them to pursue roles in the field of research, to contribute to the literature of their field of interest, and to find solutions to different problems and questions. Personally, both Vice President Denise Carvalho and I have experienced this, and we would like to thank Dr. Alfredo Ardila, who was unable to join us today, for all of his support and guidance. Dr. Ardila is an uplifting professor and mentor who taught us the value of research. He encouraged us to pursue research initiatives, and these initiatives allowed us to represent our institution in both national and international conferences and symposiums. So today we're happy to be hosting our institution's own research symposium to highlight the projects conducted within our university by our peers. We have a wide range of topics that we are prepared. Students prepare from different programs, and we want to thank all the faculty members who helped the students prepare their projects, including Dr. Arbello, Dr. Ardila, Dr. Didona, and Dr. Stevenson. We also want to encourage all the students to continue conducting research, and we want to invite faculty members to support their students. Together, we can all support student success and ultimately our institution's success. So for today's event, please note that the students will be presenting the research and then we'll be opening the floor for questions. And again, thank you very much for joining us today and good luck to all of the presenters.
So now we're going to move on to the actual poster presentations. And so Rita, I'm going to ask you to share the presentation, and we have an agenda that we're following. And we have one student who's trying, she might be logged in already, Camilla Toro, but she was trying to log on from a flight, just so that you're all aware. She's on a flight and she was trying to log in. So she might be on, and if she's not, Dr. Dodona has graciously offered. Dr. Dodona, thank you, because you sponsored several students and we appreciate you. We want to honor you. Yeah, we want to honor you for that. Thank you. And so Rita, if you don't mind moving, thank you so much.
Absolutely. And our first presenters are Yasmin Arias and Rose Alicia Oliveras, who collaborate with Dr. Evangeline Alonso from the PsyD program on their presentation, Does Faith Minimize the Adverse Psychological Effects of COVID-19?
Hi, can you hear me? Okay, perfect. So good afternoon, everyone. As Rita introduced us, my name is Yasmin and I worked with my colleague Rose, and we're going to be introducing our poster today. And it's called Does Faith Minimize the Adverse Psychological Effects of COVID-19?
Yeah, so the purpose of this literature review was to examine if religion or faith minimize the psychological impact of COVID. People have religiously coped with epidemics in the past. Therefore, this review attempted to find if individuals are utilizing religion to cope again with the coronavirus pandemic. Moreover, COVID-19 has significantly impacted individuals' mental health. Thus, this review sought to analyze if religion mitigated these adverse psychological effects of the coronavirus outbreak.
For our design, we reviewed a total of 28 articles and decided to retain 10. Our inclusion criteria consisted of full-text peer-reviewed articles published in English between the years of 2000 and 2020, and we excluded any articles that had to do with other epidemics and biological or medicinal components of COVID-19.
And we will move on to our results section but for the sake of time, I will only be reviewing a few articles within a results section. But to begin with, one of the articles explains that faith perspectives bolster efforts to promote healing in communities otherwise unlikely to utilize Western mental health services. So within these communities, social connection served as a first-line coping pathway. Moreover, other articles described how achieving and maintaining a sense of belonging through religion was found to be crucial to one's physical and mental health, as religion provided a source of meaning and significance, which is considered a coping resource that promotes resilience. It was also found that religious rituals relieve anxiety. Furthermore, in our review, we found that infodemia, such as misinformation, conspiracy theories, COVID as hybrid warfare, stigma, and racism have all contributed to a decline in global mental health following the pandemic. So these authors have proposed an empathic civilization utilizing global unity in order to develop resilience and cooperation.
In addition, we found that COVID-19 can cause serious mental problems, including acute stress, insomnia, severe anxiety, and chronic depression. Rapid transmission of the virus and higher morbidity of COVID are increasing hysteria and anxiety. Communities with certain beliefs should be benefited from spiritual education. Lastly, studies showed that healthcare practitioners who provide spiritual care to their patients contribute significantly to improve their patients' overall well-being and show increased immune functions. Spiritual care practice encourages coping strategies for stress, promotes recovery, resilience, and prevents burnout.
So in conclusion, our reviewed literature showed it is undeniable that COVID has impacted individuals' mental health and indicates that spirituality is significant in healthcare because it promotes immunity. Overall, the research showed that faith can help people cope with adversity by, number one, encouraging them to reframe events through a hopeful lens, two, fostering a sense of belonging, and three, cultivating connection through rituals. In fact, religious coping buffered negative emotionality for the majority of the general population of believers. However, it can be detrimental to mental health and undermine healing if one believes that COVID served as punishment, is devastated by the limitations social distancing imposes on their religiosity, or is a religious leader whose spiritual duties posed a moral injury.
In regards to limitations, at the time of this literature review, COVID-19 was still a recent event and is still a recent event. Hence, research was limited and was gradually being released. Additionally, the current research examines data regarding specific demographics, which can limit the ability to generalize information to the population. In our studies, we discovered that few articles integrated information regarding faith, pandemics, and mental health. Ergo, this could be an area for future research.
And that is our presentation. In short, the answer is yes. Thank you for listening.
Thank you, Jasmine and Rose. Do we have any questions?
I have a question. So what was your interest in this topic?
So Yasmin and I are part of the Religion and Spirituality Club with under Dr. Alonso's supervision. And we started realizing, at least for me, that I am of Christian faith. And so I realized how my religion may have been impacted. So for instance, moving to services online, how that impacted myself. And usually religion was a source of coping for myself. So I wanted to see if there's anything in the research or in the literature that would support or not support this hypothesis.
Excellent. Thank you.
Thank you.
We have a question in the chat box. It says, did you explore any specific faiths or religions?
I think we kept it pretty general. We pretty much looked for religion, faith.
There's also some of the articles included specific populations. So for instance, one was based off of, I think, Muslims in Somali. Mm-hmm. And basically in populations that don't utilize Western mental health services. So for instance, that would be an example of that population. Religion was more likely used as a coping mechanism. So, and also I think we had an article on Israeli Jews as well, mm-hmm. That basically communicated the same point, that religion for people who don't utilize, let's say, going to a psychologist or something like that, religion was the first pathway for coping. So overall, we tried to generalize these results though. So I think that's what Yasmin was mentioning as well.
Thank you, guys. It seems like a very interesting topic and relevant to what we're all going through right now. So we're going to continue with our next presentation. Obsessive-compulsive personality disorder and characteristics of treatment resistance.
Yes, thank you so much, Rita. This is my presentation. We're looking at OCPD and the types of characteristics that they could have that show up in your therapeutic alliance that cause resistance. The purpose for this was because approximately 1 in 100 US citizens, twice as much men than women, would reach the criteria for this disorder. This would also lead to more that would probably don't meet it, but at least to some degree have this manifestation of criteria, of disorders, and despite this like high prevalence rate across the ICD Foundation, across our APA, which we do look to, there is no real clear cut of diagnosis and in terms of the treatment efficacy, especially for severe cases of OCPD. And so those characteristics can range. Of course, we have OCPD knowing as excessive orderliness, you have your neurotic perfectionism, you have your attention to detail over the task at hand, you have your interpersonal inflexibility. This would be like your miserly spending, your hoarding, your lacking of delegation of tasks to other people. And it also is highly comorbid across other disorders and illnesses. So the types of treatment that work for OCPD don't really account for it, especially when we compare it at beginning and at point of discharge or at the end of the treatment. And that's because personality disorders are stable. They're constant over years, even. A lot of literature is debating about that, but it's still pretty prevalent. So from an evolutionary behavioral point, we're going to look at the course of OCPD. We're looking at those evidence-based measures, as well as maybe some adjunctive measurements that we can have in your therapeutic alliance. You can see those resisting characteristics that can show up, and then those modalities that maybe can help target any specific criteria that can show up in your alliance. Of course, we used about 20 articles, 17 were retained, all English, all ranging from at least 2011 to 2019. So at least a little bit more relevant, but still. Across all the studies, what we did find was that perfectionism and rigidity, or that inflexibility, was the common trait. The reason why we look across is because actually our DSM has a section 2, which is our general, like if you hit 4 out of 8, OCPD. But the section 3 is actually the alternative criteria. And a lot of research has posed more questions through there too. And there you have to have one specific trait with 3 behaviors that follow times 2. So even though there's this differentiation of criteria, that leaves room for evidence and more research about how we manifest DSM criteria and how we see it in our light. And then as well, side note, the ICD, the way that they manifest OCPD in their literature, how does it compare to ours? We also can look at the variety of tools and assessment that we could use for our therapeutic alliance. We will get to that. And then of course, we need to consider the populations of this. A little earlier, we mentioned that it affects twice as much men than women. And this is really important, I'd say, because personality disorders get the majority rep, whether it's from the general population, maybe our own internal biases, that it's more female oriented. So what are we doing to challenge ourselves with that? And as well as adolescence or early adulthood, we have, that's generally the onset for this disorder, but we will not consider that for any kind of personality disorder. -1 that sticks out, but still, it's a considerable area of research. And so at the table at the top, it might be a little blurry, but those 4 little questionnaires that you see will be our evidence-based measures that are best practices, they're tried and true across not just OCPD, but a lot of other disorders, but can help with alleviation of, or at least recognizing OCPD when it manifests. Your patient health questionnaire, your generalized anxiety disorders, your difficulty in emotional regulation skills, suicide severity rating scale. These are all, like, of course, really monumental, really evidence-based measurements that we can use. And we'll also have some adjunctive measurements, maybe like the DERS non-acceptance subscale could be considerable, a relationship questionnaire. And then for adolescents, your CY box, which we will discuss a little bit more. So some evidence-based treatment would be, of course, our traditional CBT. That method has always been tried and true as well in alleviating our symptoms. And our second little table over there across baseline versus 12 months later. So let's say that you have a client and you have insurance and your sessions are low, because personality disorders can be pretty persistent across years. Short inpatient, the 4th option, showed the most significant differences in symptoms. So it could be a considerable area if that's your route. Obviously, other adjunctive therapies could be mentalization-based therapies. You have your metacognitive interpersonal therapy that promotes that self-awareness, that reflection, schema therapy for those core beliefs and events that they have. And if there's a disintegrating therapeutic alliance that you might have with that client, a really deep and integrative part is functional analytical psychotherapy. Which is a very serious and very intricate therapy, which I definitely recommend everybody to check out Manducci's, the resource that I have there. But I do have a PDF that has all the DOI links if you need it. But there you have a script of the first time a therapist is using this therapy. And it's very intense, so really considerable stuff. And then as well as SSRIs, if we have some neuropsychology majors in the house, or like anybody that has that interest, escitalopram or Lexapro, as it's more commonly known, is actually a treatment used for Parkinsonian traits, which have a considerable overlap with OCPD, about 40%. That's what the literature has been saying. And it focuses on the frontal lobe, the basal ganglia. This is like motor activity, the execution of activities. So if that's considerable for Parkinsonian traits and there's considerable overlap, it could be as well for us. And if you have comorbid OCPD, maybe depression, maybe a little bit more of that strong perfectionism, you have your fluoxetine or your Prozac. And so in conclusion, we do have some traits that we discovered to be resistant, but traditionally ego-syntonic, or that ego sameness, and ego-dystonic, or that ego separation, was the way to describe OCPD and other kinds of PDs. But now, as we unravel in our research, we can consider updating that. Evolutionarily, we have seen these clusters of behaviors to be supportive. You know, you have your migration, your seasonal elements, your selective stress with future catastrophes throughout eons of humans developing. Like, these selective clusters of behaviors have existed together, as pointed out by Freud, which was one of the first few people to create this character. And so we do have your CBT, but that schema awareness is what can help. A failure to that, you go to your MIT. And if you follow with a 12-month checkup and it doesn't really have any alleviation of symptoms, you can consider that functional approach psychotherapy, because it's targeting that therapeutic alliance. And so we can consider some adjunctive measurements to be, of course, our structured clinical interview, but the relationship questionnaire, measuring that attachment anxiety, measuring that avoidance with preoccupation, and that belief of self-reliance. You have your POPS, or your pathological obsessive compulsive personality scale. This is, of course, measuring your traditional 4 out of 8 criteria that you see in our DSM. You have your Children's Yale Brown Obsessive Compulsive Scale. This would be helpful for more OCD with traits, because of course we cannot diagnose PDs at an early age, but it can be measured still. We can consider some possibilities. And of course, DERS, our difficulty in emotional regulation, considering impulse, non-acceptance, and these measurements can be provided as one way to manifest and understand the person that's sitting across from us if they do manifest these traits and behaviors. So I do now want to leave some room for questions, but thank you for listening.
Thank you. Does anyone have any questions?
Everybody. If anything, I could also attach I have attached the file with all the DOI links. I would definitely highlight Manducci's, because you will get in the appendix a script of the therapist using it for the first time. So if that's something you are interested in and seeing how it works, you can check that out. But thank you, everybody.
So we're just getting a lot of positive comments in the chat box that says, good job, excellent, thank you, great work.
Appreciate the support, y'all. Thank you.
Okay, so we're gonna move with our next presentation, Organizational Citizenship Behaviors and Sexual Orientation by Kenya Machado and Dr. Tony Di Donna.
Hi, hello everyone. Well, my work is about organizational citizenship behaviors. I don't know if you are familiar with the term. We are talking here about those behaviors that are associated with employees, job satisfaction, and organizational well-being. We are including here prosocial helping behaviors, sportsmanship behaviors. These behaviors, they refer to go above and beyond. They are not part of your duties. So you don't have to be actually in compliance with these behaviors. And the main purpose of the study is to investigate how social and psychological factors, such as individual differences, gender roles and equality, moral values and beliefs, personality traits, self-determination, and sexual orientation may drive individuals' behaviors at the workplace. And I mean, I was able to answer to the question that sexual orientation matters when it comes to helping behaviors at the workplace. There are a lot of stigmas and prejudices in regards to sexual orientation. Okay, we created an online survey, and it was provided to each participant, who were also informed about the rights of anonymity and confidentiality before answering to the survey. And we measure, basically, we asked them to answer to demographic questions that were addressing age, gender, sexual orientation, income, marital status, level of education, level of professions, and we were able to recruit 454 participants. We had 279 women and 175 men. The mean age for the total sample was 35. We have in our sample white non-Hispanics. We have like Black African Americans, Hispanics, and multiracial. And regarding sexual orientation, and this is an important data that we collected, 78.84% out of the entire sample were identified as heterosexuals, 12.56% were homosexuals, and 8.60% were bisexuals. Although these numbers of participants in the three subgroups mentioned before are small, and it would not be appropriate to generalize to the respective populations, these numbers will not be significant if they would validate it or compare to a larger group that we don't have. There is not enough research in this area that we can use to compare or to establish any type of relation. So I think this is the most important aspect of this research, that we are actually trying to contribute to science in the area of IO through this work. A one-way analysis of variance ANOVA was conducted to determine whether there was difference between the means of heterosexuals, homosexuals, and bisexual groups in terms of OCBs. The results found no statistically significance between these three groups. Therefore, it can be concluded that sexual orientation does not impact, affect, or change organizational citizenship behaviors. This study has some limitations that may be due to the convenient sampling or snowballing sampling and sample bias, such as the high percentage of Hispanics in the sample and the high percentage of women in the sample. In conclusion, we can state that a better understanding of factors that may influence stigmas and prejudices in regards to the behavior displayed by individuals in organization is necessary. Employers should be aware that sexual orientation does not influence positive individual behavior at the workplace, and further research may focus on the other social and psychological factors that to determine whether they affect or not in a positive or in a negative manner organizational citizenship behaviors. That's my work. Thank you so much.
Thank you, Kenya. Do we have any questions?
Thank you.
I have a question. Oh, wait, did somebody else have a question? I thought I saw a hand up. Okay, so Kenya, I want to ask you about, do you think a larger sample size would have really mattered, or a different demographic? Could those have been factors that might have changed the outcome? Because what Dr. Dodona says is correct. No difference is okay as well, absolutely. But what do you think? What's your insight on that?
Well, on I mean, I would like to have a bigger sample and more diverse sample, obviously, but it was very difficult to actually get the LGBT participants participating into the study. That was the mission. It was very, very difficult. They were reluctant to participate in the research because they were not trusting on the real purpose of the study. And of course, I mean, it's part of the limitations, the background and ethnicity as well. But I think that we had a pretty good sample because we have 17.8 white non-Hispanic percentage in the sample. We have 19.4% of Black African Americans.
Oh,
We have like actually good numbers. I think it's significant. It really is.
great job. Congratulations. And very important research.
Thank you so much.
We have a question in the chat box that says, such an interesting topic. What motivated you to conduct this research?
Inclusion at the workplace.
Excellent.
Great.
I would like to make a comment for Dr. Didona and myself, who have taught IO for quite a while. I want to clarify something. Organizational citizenship is related to going the extra mile at work. It's related to actually being a person who is very responsible and capable of doing their job. But in addition to that, they actually do not have a problem going over and above the call on duty. So what I think that your study is demonstrating is that there is no differences among people, regardless of their sexual orientation. People are going to have high organizational citizenship behavior if that is in their nature, if it is in their nature to help others. So I think that actually the null hypothesis was important in this study, which is no differences, and that's what you found. So that tells you a lot about inclusion and about equality. So I think I commend you for that work. Very well done. Thank you.
Thank you.
And now we're gonna have, does having higher independence correlate to higher organizational citizen behavior, by Manny and Dr. Didona?
Hello. Hello, my name is Manny Lizarazo. My research is also focused on organizational citizen behavior and its correlation to independence. So as Dr. Bravo had pointed out, OCB, the original definition of what was denoted as OCB was extra work behaviors. And it's really a set of pro-social behaviors at work that focus on helping the organization. Okay, that's really the difference between pro-social behaviors at work, directed at one person in particular, as opposed to directed at the organization. OCB is not regarded as task specific, it's not delineated in your work scope. So it's something that goes above and beyond. It's volunteering for extra shifts, it's showing up to company picnics, is participating in different facets of the organization without having been asked to do. In modern times, OCB has shifted a little bit, and now it's not so much as extra work. It's not so much extra work, but it's somewhat tied to performance. You see it in buzzwords like taking initiative. It's showing leadership. It's kind of tied to that regard. So it's shifted a little bit in the past decade or so. The other side of it was I wanted to explore how independence correlates into that because of that shift in mentality with OCB. So I looked into independence and what is that a factor? Does that correlate to having organizational citizenship behavior, OCB? And independence has also kind of shifted a little bit. It was part of the cultural setting. It was perceived as a cultural, as part of the culture. Now it's more looked at as a personality trait. So the purpose of the study was really to identify if there was a correlation between independence and OCB. So again, the survey had a lot of demographic questions, and some of the results are shown in the graphs. Essentially, 77.5% of the respondents were really highly educated. They had an associate's degree or above. Most of the respondents were female. And race-wise, a lot of them identified as Hispanic. When it came to the results, the correlation was not, I couldn't run a correlation analysis because the assumptions for the criteria for a correlation analysis were not met, specifically homoscedasticity. It wasn't met, as you can see by the distribution in the scatter plot. So I took one step forward and I chose two statements in regard to the chi-square. So, my identity is independent of others. So how it's in a Likert scale. So if people value it, if they strongly agree or disagree, and then if I volunteer for extra shifts, extra work. So I wanted to see if there was a relationship between those two statements, since I couldn't run a correlation analysis. And I found that there was a significance between those two statements. So what does that tell us in the context of this research, of the survey, is that essentially if we are able to identify someone who self-identifies as a little bit more independent, then maybe they will be more likely to volunteer for extra work. And how does that help us in work context? Well, it leads us to how can we match better our employees with certain onboarding activities and orientation activities, essentially getting new employees to be part of the organization. Again, some of the limitations for this data is that it was overwhelmingly female, overwhelmingly highly educated, and Hispanic. So it might be a representation really of maybe South Florida, but if we were to go a little bit elsewhere, more diversity in the sample and a higher sample would have been a little bit better. Thank you.
Thank you. Do we have any questions?
So I have a quick question for you, Manny. And by the way, that was an excellent presentation. Can you explain the idea of the pre-test checklist for running a correlation to us? Thank you.
So there are three assumptions for statistics that need to be met in order for a correlation to be, for a test to be really taken as valid. So it's homoscedasticity, which means that the scatter plot, the results have to be toward the center. There has to be linearity, which means that there is a relationship between both of the constructs, really, that it's linear in presentation, and that there should be normality between the presentations. Well, the constructs.
Excellent. The bell curve, the famous
Yes.
bell curve, right? The nice tight bell curve.
Yeah, normality means a bell distribution of the results. So it should look kind of like what you would see with the IQ test and
right.
The spread.
And so you ran a non-parametric test, right? Am I
correct? Yeah.
Right. Chi-square?
Yes.
And those are alternatives, right?
Yeah, it had to be an alternative because correlation, homoscedasticity is really hard to meet, really, when it comes to with a snowball sampling. With the type of sampling that I had, you're just not. It's very difficult to see the assumptions being met for a correlation, and with the sample size that it was, that could also have been presented a problem.
Excellent. Thank you for answering all of my questions.
Thank you.
Some very positive comments on the chat box. Excellent work, beautiful graphics, good job, amazing detail. So if no one else has any questions, we're gonna move to our next presentation. Are we practicing what we preach? A review on doctoral psychology students' utilization of personal psychotherapy by Jorge Alsina and Dr. Pamela Dolan.
Hi everyone, I'm Jorge Alsina. So my topic, as Rita mentioned, is Are We Practicing What We Preach? Or reviewing doctoral psychology students' utilization of personal psychotherapy. What essentially makes this topic relevant or important? In a survey by the American Psychological Association's Committee of Graduate Students and its advisory committee on college assistants, it was found that about 70% of graduate students had experienced some type of life or academic event that essentially taxed their functioning while they were in training. Student trainees, especially doctoral psychology student trainees and counseling, clinical, or school psychology, have to typically deal with a variety of added challenges such as extended practicum and supervisions, internship matching, and keeping a certain academic standing that can have health and psychologically taxing effects. And while the challenges have been reported in the literature, some of them are actually, the effects of them are deeply understudied according to Rummel 2015. In their practicing lifetimes, fast forwarding a little bit, psychologists are expected to experience a variety of burnout, clinically significant depression, anxiety, substance use disorders, and many other different detriments to their vitality as professionals. About 40 to 60% of them reported functional impairments related to depression, anxiety, burnout in an APA study in 2009, but rates in other studies have fluctuated up to 70 or 80%, with ultimately about 80% of psychologists seeking psychotherapy to mediate some of these. Certain risk factors tend to impact how graduate students experience either early burnout or career dissatisfaction. These include poor supports from advisors, stress, inadequate social supports, and other protective factors now, such as sleep hygiene, social support, amongst others, kind of mediate how significantly they experience this. In figure 1 here, we can see some of the detriments to some of these coping protective skills. What is the overall purpose of this poster? It is to explore doctoral level graduate psychology students of personal therapy and its personal and clinical effects. Overall, 12 articles were isolated using exclusion and inclusion criteria that you can find here. And 4 major areas of knowledge were also isolated. Predictors and deterrents of psychological help seeking for student clinicians was one. The next one was personal therapy and how it relates to student clinicians' ability to form a strong therapeutic alliance. The third was mandated psychotherapy, the experience of student clinicians and programs that essentially mandate that they receive psychotherapy. And the fourth was personal psychotherapy used in the remediation of trainee impairment, which is now simply regarded as not meeting certain APA competencies that are delineated. What were some of the most common predictors for students who do seek psychotherapy? Wish to improve as a therapist, adjustments or developmental issues, depression, and desire to increase personal effectiveness. Some of the most common deterrents were found to be cost and confidentiality concerns, fear of professional censure, stigma, shame, embarrassment, perceived lack of time, and preference for an independent, kind of more autonomous problem solving. Regarding personal psychotherapy and its ability or influence for student clinicians to form stronger therapeutic alliances, student clinicians' self-rated alliances did not significantly correlate to their patients' rating of therapeutic alliance. Inconclusive data in these 2 studies was also found regarding treatment retention of patients whose student clinicians had partaken in personal therapy, and some reported benefits were increased confidence in conducting therapy, agreement with goals and tasks, more of a process understanding, and patient symptom reduction in one of the studies. Regarding mandated therapy, experiential learning, understanding of the therapeutic relationship and techniques, increased empathy and self-awareness, personal and professional development and growth were reported benefits, while some of the negative themes reported entailed the stressful ambiance of therapy, emotional self-injury, and the recurring threat of cost and time concerns, as well as perceived lack of need. Lastly, pertaining to personal therapy used to ameliorate trainee impairment, 2 of the studies found that recommendation of personal therapy was regarded as top 1 and 2 most commonly used remediation methods across a variety of doctoral programs. It was also found by Elman and Forrest that most programs who actually recommended psychotherapy used a hands-off approach, which means that they recommended but did not mandate or require psychotherapy. And a comparison study of doctoral programs and internship sites found that doctoral programs are more likely to recommend personal therapy than psych, a comparison of about 75 to 50% to address training impairment. The need for empirical studies in this area of research has been long-standing since, I want to say, the 80s and 70s. Due to the shortage of studies on the topic, Dr. Dahlman and I set out for about a time frame of about 25 years, dating back to 1995. Major areas, again, that predicted help seeking for students entailed wish to improve as a therapist, coping, and personal and professional development, while cost and confidentiality were common threats. Faculty attitudes in one of the studies was actually found to not only be related, but to mediate whether students sought personal therapy or not. Students, clinicians, therapeutic alliances, how it pertains to personal therapies, did not show significant correlation, but there's preliminary support thus far for, obviously more research is needed, but there may be preliminary support for symptom reduction for patients whose student clinicians do receive personal therapy. Mandated therapy was associated with a lot of this experiential learning, understanding the process and steps of therapy, while also being impacted by the time and confidentiality concerns and potential emotional self-injury, having to pay more attention to your personal troubles versus your patient alone, although a case could be argued for both. And lastly, although it was found that personal therapy was recommended significantly for training impairment, very few studies, as noted by Elman and Forrest, are actually in place that validate the use of this remediation technique. Some of the limitations of this study include small sample sizes. Some of the studies had 1,018 students, some had 8, and some others had about 103 doctoral programs, whereas others had about 14. As well as methodological limitations, only survey area was found regarding this topic. Further research should also assess or validate recommendation of personal therapy as a remediation technique, as well as further research should look at the correlation between students, clinicians' engagement in personal therapy and the effect on the therapeutic alliance, as well as therapeutic outcomes that student clinicians may experience, for example, coping skills acquisition or symptom reduction as a result of personal therapy. That is it. Thank you very much for your attention.
This isn't a question, but I know that we can have comments too. But I think that this is one of the most relevant topics that you can present on right now. I think with the craziness that 2020 was in regards to COVID, in regards to the election season and all these crazy things going on, I can imagine it impacts us as professionals and clinicians, students, and even professors. So if it impacts us, the results section and all that you discussed is important to keep in mind, especially in regards to how we approach our clients and all these, I guess, we have to take care of ourselves before we go on and take care of others. So it's extremely relevant that you brought this to our attention. So thank you for sharing.
Thank you very much for the kind comments. I appreciate it.
Do we have any questions for Jorge?
I have a quick question. If no one else is, I'm sorry, I keep jumping in. I'm just curious. And I love talking to students about their research. So you said something interesting. You said there were studies that had 1,018 and studies that had 8. And I'm going to assume that those studies that had 8 participants were qualitative in nature.
Right.
So they were interviews, focus groups, like digging deep into.
Right, semi-structured interviews, essentially looking for thematic analysis, right?
Right. What do you think about that? What did you think about the findings between the two? Or if you can even speak to that, because I know you reviewed so many.
Right. Interestingly enough, a lot of the predictors and a lot of the reported negative themes overlapped in terms of experiential learning, dealing with, own psychopathology to preserve vitality as a practitioner, and then cost and confidentiality, as well as increased time that needed to be allocated to personal therapy, and, with a busy doctoral schedule. Some of those actually overlapped significantly for both
Excellent.
kinds of studies.
That's excellent. Thank you.
Thank you very much.
Thank you, Jorge. Very important topic indeed. And if no one else has any questions, we're going to go with our next presenters, The Evolution of Colorism, History, Consequences, and Solutions by Mauni Sanchez, Stephanie Sarcote, Arlene Silva, Priscilla Valerio, and Dr. Edward Stevenson.
Hello, good afternoon, everyone. First of all, thank you guys for actually doing this. We've been going through a lot of stuff this year. This is all new to us. I'm glad that we were still able to execute the symposium. So good job, guys. This is a topic that I kind of jumped on board when I heard that these girls were so passionate about this topic. With the relevance of Black Lives Matter that we've had in 2020, along with everything that has been going on, this is a topic that is very close to everyone at the moment with everything that's been going on. So what we started off with is on the topic of colorism. Colorism is defined as a prejudice against persons on the basis of their skin color complexion. So this is what I call a minority within a minority. So what we're seeing is that not only is there an umbrella of racism going on, the regular Black versus white, situation, but we also have the complexions that are, the grays in between. So we're seeing that the minorities are being affected by their minority peers as well. So let's say a African-American person is trying to strive in their world, trying to be a productive citizen. They're being faced with situations within their own community that is keeping them to accomplish, certain things, staying out of trouble, for example. So the criminal justice in colorism, as well as their education and what they are able to attain, as well as the effects that it has on their mental health, and and looking for a job and things like that. So what we searched to do was to create this literature review to kind of encompass and trying to see the timeline, the evolution that has kind of led up to this moment. So we see what we have here is a timeline of, for example, historical events, which Mauri will start off in explaining. What we're gonna be covering is the criminal justice and colorism, education and colorism, as well as mental health and colorism. There's little room right now with everything that has been going on. This topic has been kind of swept under the rug because it seems like, everyone thinks that there's bigger fish to fry. But the truth is that there's a lot of things that trickle into this problem, and figuring out where the problem starts is kind of the way to figure out how we're going to resolve this solution. So we are establishing the problem, we are establishing the information that is out there so that we can then help the next set of students, or if not ourselves, in finding the solutions that we need. In the process of doing this literature review, we used what we are very aware of, the databases like Info, EBSCO, Google Scholar, COBIMET. We actually we made sure that all our articles had a bigger sample size than usual. Just because, like I said, the topic of racism has been studied for a long time. So the information is there. So there's a lot of population, a lot of people that have participated in actually developing this topic. With that said, I'm going to go ahead and hand it over to Mauri, who's going to go ahead and talk about the criminal justice and how it relates to colorism.
Yes, hi. So just before we start with, the topic of the criminal justice, we introduce what is a little bit of the history, so we're able to understand how colorism come about, especially in the United States. We know that colorism, it's a worldwide phenomenon, but it has different characteristics here in the United States. So everything started, of course, in 1619. As you can see, the orange, it's the actual dates or the important dates that we separated, and then the purple ones are just kind of the ramifications, right? So everything started in 1619 when they brought the slaves from to Jamestown, Virginia, and it's just basically for the purpose of doing the chores in the house and then the production of the cotton field. Then around 60 years later, it's around 1679, that's when they started this racial classification, because of course before they didn't have census or anything like that, so they really, race didn't really matter that much. But of course, since whites were the ones that were in charge of mostly everything and they own slaves, they basically put white race as kind of superior. And of course, that's where the stratification of the race came about, because they separated the house person and then the field person. The field person was identified by a darker hue, and the ones that were in the house were kind of like on the lighter side of the African Americans that came into the United States. So of course, the black or the darker black was also kind of ostracized or just put on the side and just kind of being more looked as a worse in the hierarchy of the race. Then in 1863, that's when the Emancipation Proclamation became a reality. Abraham Lincoln, the President Abraham Lincoln, in September 22 of 1862, that's when he changed the federal under federal status to basically free the enslaved. And then a year after in 1863, that's when it became kind of like a reality. In 1865, the 13th Amendment abolished all slavery. Then that's when it opened up a little bit with the Black Code. So the Black Codes were placed were in place just to limit some slave to move, right, for social mobility. So even though that they were already free, President Lincoln actually proposed to limit African Americans' voting rights. So that was kind of very limiting them as well. And that was the creation or the initiation of the Jim Crow era. And of course, we know the Jim Crow, it was, separation of the race. And of course, in 1880, the Jim Crow's laws were expanded. So now, how that expanded into the criminal justice system, it's very interesting because, of course, Blackness was always associated with crime and poverty. So although we have the knowledge that a lot of Black people are in prison, studies actually show that there's not really a disparity between races. Both races, white or Black, they do get in prison kind of at the same rate. However, it's more about the social structure that was founded, or the foundation for the African Americans, that made, African Americans to be a higher representation in the criminal justice system. So basically how it happened, African Americans, the Blacks moved from to the northern side of America, just kind of looking for more positions, etc. But that's when, crowded areas, they, become very impoverished areas. So of course, a lot of African Americans were kind of like put in prison on a higher rate, just because there was more vigilance in the smaller areas. So they have found, some studies have found that a lot of the disparities are not just Black and white, but it's just within. So it's a lot of the characteristics. So a lot of the African Americans that have more ethnocentric type of characteristics get more targeted, or they get imprisoned more, or they feel, there was another study that they explained that they get stopped at a higher rate than maybe somebody that has more of like white or European type of facial features. So definitely this is a study that needs to be, conducted just to really see the difference in the skin hue and what it makes the difference in the criminal justice system. But definitely reading through all of the materials that we read, it was around 50 research, I'm sorry. Definitely we found that there was differences between the rates that African Americans or darker African Americans get in prison. So now I'm going to call my colleague Stephanie Sarcote. She's going to be talking a little bit more about the education side of it. Thank you.
Thank you, Maldi, and thank you to everyone who participated in the event. I'm very happy that we all could gather here today to kind of elucidate everybody on serious issues that are going on in our community. So just to talk about education and colorism, studies have found that light-skinned Black people attain higher more schooling than their darker skinned counterparts. Colorism tends to reveal itself in the classroom with student to teacher interactions, peer interactions, classroom dynamics, school discipline guidelines, and family school interactions. Studies have found that light-skinned Black children may be seen as more attractive or given preference over darker skinned Black children, whether consciously or not, due to ethnocentric beauty standards. We've found that darker skinned girls are more likely to be teased and objectified than dark skinned boys. And as colorism works as a subset of systemic racism, it does not require white vigilance, only the internalization of hierarchical skin stratification and Eurocentric beauty standards. Basically what that means is what our studies have shown is that colorism in the classroom or in educational settings doesn't necessarily need white practitioners. It just needs an internalization of the idea that light skin tends to equate to certain different higher standards than a darker hue. Data from 2011 to 2012 showed that Black females were 3 times more likely to be suspended from school than the national average of their counterparts. And within that data, Black skinned females were twice as likely to be suspended than white females, while this discrepancy did not extend to light skinned Black females. So some of our research in education has shown that colorism does have an impact on the way that teachers view their students, and then the way that teachers view the actions of those students. Certain children, particularly darker skinned females, can sometimes be policed as given certain pseudo-sexual behaviors that can extend itself to social control. So we have to be aware of how the teachers are viewing the children through certain beauty standards. And of course, I want to turn to my colleague Arlenis to kind of continue to talk about how mental health is impacted within this dynamic.
Thank you, Stephanie. So we wanted to investigate how mental health and African Americans are affected by colorism. In the search for literature, we found several studies that measure the different factors that influence the perception of the self, self-esteem, relating to others, racial identity, and resilience. So a study conducted in 2017 suggested that African American students are face a misconstrued perception of themselves because of colorism. One of the priorities of that study was to investigate the imposter phenomenon, which is defined as persistent perception of being incompetent even after contrary evidence, and how this affects mental health. And amongst the 112 undergraduate African American females that were surveyed, they found that African American students who do not view African Americans favorably and subscribe less to their African American identity may potentially internalize and perceived as others in higher education and don't feel like they belong. In another article, researchers found that African American adolescents lack the attributes necessary to partake in productive school bonding, grade retention, which put them at a higher risk for mental health issues as well. And also a study conducted in 2018 found that racial identity beliefs are important to the development of being a productive citizen. And unfortunately, due to colorism and other factors, the study looked for ways to increase these beliefs in African American girls. And the findings contributed that African American girls lacked the protective factor of racial identity necessary to become resilient and productive individuals. And lastly, Priscilla with solutions.
So what we're seeing here is that there's an obvious problem. It's a problem that's been going on for a very long time. Unfortunately, it hasn't been really paid attention to because of the bigger umbrella of racism, as I mentioned before. So we need to definitely move in a direction that we start becoming aware of almost like the microaggressions that are within, like I said, minority within a minority, and how those things factor out, because it's not only one thing that feeds into the entire umbrella of racism, or the disservice that may do across all races. We don't only have African Americans that are darker. We also have Cubans that are darker skinned, that are seen as less productive, or may be jailed a lot more. We also have Dominicans. We also have Asians. We have there's all types of darker skins, darker complexions that aren't being paid attention to because of the black and white. So we need to start looking at the grays in between, because that's the only way that we're going to resolve this. So in addition, we need to bring this awareness up to politicians, to our leaders, and let them know that the problem is not only in black and white, but also, like I said, in the grays in between. Thank you so much for your time, guys. If you have any questions, now would be the time. Thank you.
Yes, I have a question. I think that you great presentation, very well organized, very clear. Thank you very much. One of the things that I heard in the literature, at least in the past, it was that the media influenced this problem quite a bit. And so, for example, TV shows that would also show individuals of color in certain positions of maybe side roles, or not necessarily the principal roles, etc. But that has been changing over time. So when you actually watch one of those shows, you will see that individuals of color have central roles in those particular shows, or in movies and so forth. So what I was wondering, if it's that in moving forward, looking at the progress and looking at how much more advancement has been achieved over time with these changes, and see whether or not those changes are creating an impact on society now. So, but I commend you. I really commend you. Based on the Black Lives Matters movement, I think that this is extremely relevant. But I think that it would be interesting also to see how the tide is changing and how it's improving over time, because that will give us all hope. Thank you.
Thank you.
I have an observation. This is Dr. Martinez. I like the construct of colorism. However, I don't know how I could explain, for example, thinking about Miami, when a few years ago, when we had a large influx of Asian Americans into the area, Asians and Black Americans or African Americans were having a lot of tensions. How would this construct play out? Because we're talking about Blacks. We're not talking about race. I think we're talking more like ethnocentrism, but I'm not sure. I like the construct of colorism, but how would it explain the dynamics of like what happened in Miami with African Americans having, a lot of tensions, a lot of ethnic tensions with the Haitian Americans that were newcomers to the area? And Priscilla, maybe you want to answer that, since I know you.
Hey, Dr. Martinez. Like I said, it's a whole umbrella effect with this, with this literature review. We were kind of trying to start it off. We were just trying to build awareness and to kind of like moving into the evolution of how it kind of translates or manifests into different situations, like the one that you met. There's something that I've been privy to here living in Miami is the difference in culture. Like you said, like we have Black Haitians, we have Black Jamaicans, we have, an array, a variation of Blacks. So how do you how does it manifest amongst that? Well, what we're seeing is that it's still the same thing, even if the umbrella of racism is encompassing, the white versus black, so it's kind of like everyone is now on, to put it in layman's terms, everyone's kind of like on the black boat. So we're all in the black boat, but within this black boat, you have different rooms that people are kind of pushing each other in, even though, and it's all based on complexion. So you may have a Haitian, for example, that may be darker skinned, and you have maybe their brother, for example, that came out, a little lighter. And unfortunately, we see that their parents may be treating them differently, maybe giving them different chores because of the societal pressures that they get as a family unit, to kind of do this same social stratification. So we're seeing that that it's something that's being ingrained in children from the beginning, even from their parents, even from, in a different country. And when they come and bring these issues to, an immigration situation, it's very difficult to now deal with, the first level of racism, which is white versus black, and then the second level of racism, which is, black versus black, and then, and then black versus brown, and then black versus, so it's what I call unnecessary drama. It's a lot of unnecessary drama that's feeding into this huge problem of racism and is not being paid attention to. Here in Miami, we're very lucky. We have a melting pot of people. We are very used to our diversity. We are very used to having different skin tones, different, everything. But you go a little bit north, as far as, let's say, Davie, and you start seeing the differences. You start seeing how there's certain jobs that are no longer, that a brown person no longer has. And why is that happening? If the manager, for example, is an African American, why would he, not help his brother or sister in getting a good job or things like that? So like these are all different levels of racism that are, that people are being, taught from the beginning, that are, hard to shake off, and it's just going to end up manifesting into a big pot of prejudice, amongst everyone. So, and the truth is that we need to be together, as minorities, as Hispanics, as African Americans, as white, as everyone. We need to be together, and appreciate the variety that we have, versus pushing each other away because of our differences. So,
Thank you.
Thank you.
Very interesting topic. Thank you guys very much for sharing that. We're now going to go with Sean Michael Suarez and Dr. Irma Barron on distress of a transgender adolescent.
Hello, everyone. My name is Sean Michael, and I worked with Dr. Barron on this poster. But before I begin, I really want to thank everybody. This has been a wonderful experience, and the posters have been great and very informative. So thank you all. So let's get to it. Within the last 20 years, research in the area of transgender health has exponentially grown. This is especially the case across healthcare disciplines. A lot of the research presented has aided in the removal of gender dysphoria from the DSM-5 in 2017. We have learned that distress comes from a multitude of factors, including an invalidating society, and not for being solely gender dysphoric. Prior research mostly conducted has been on the adult population, and it became known that the adult transgender population may be combating with suicidal ideations, self-harming or self-destructive behaviors, substance abuse, emotional dysregulation, and social problems. Until now, it's been kind of unclear whether transgender or gender nonconforming adolescents may also have these difficulties with these behaviors, especially now that the gender nonconforming and transgender transgender population is now being a little more widely accepted. So when compared to cisgender heterosexual adolescents, transgender and gender nonconforming adolescents show remarkably higher rates of these distressing and potentially life-threatening behaviors. It is the purpose of this poster to show up-to-date information from across the world and across healthcare disciplines on the aforementioned behaviors, potentially found in transgender and gender nonconforming adolescents. Much of the transgender population has had to educate their healthcare providers on their healthcare needs, and it is imperative that providers screen for these potentially dangerous behaviors when they come across transgender adolescents and gender nonconforming adolescents. So for the methods of this poster, to begin with the procedures, we utilized online search engines and databases like COBIMED, PubMed, PsycArticles, PsycInfo, Google Scholar, and ProQuest. I do have to make a note in the procedures. I missed the 8 because I wrote out 20, but there were 28 articles total collected using the keywords that are listed in the keyword section. So we collected articles between 2011 and 2020 to utilize in the creation of this poster. And for that reason, or for that, we did that because we wanted to have the most up-to-date information that there is out there. The disciplines that were included in this study were mental health, psychology, psychiatry, nursing, several research groups, general medicine, endocrinology, and marriage and family therapy. The demographics used in or found in these studies included transgender and gender nonconforming children and adolescents between the ages of 6 to 18 years of age. And the studies were conducted in countries such as the US, Canada, China, the Netherlands, Germany, and Australia. And so the keywords are, there were about 30 keywords that I utilized for this study. And they're listed below in the methods section. I'm not going to read all of them because that's a lot of words to read. So as far as the results, we utilized 28 articles for the creation of this poster. Many of the articles discussed intersecting topics. So for example, a lot of them had suicidal ideation, self-harming, and social problems mentioned in the same article. The results indicated that current research is showing these adolescents may have equally prevalent difficulties with social problems and emotional dysregulation. Suicidal ideation and self-harming behaviors follow emotional regulation and social problems respectively. So one thing that was interesting was that we didn't find very many articles on substance abuse, primarily because it might be because this is an adolescent population, but I believe that more research should be conducted in this area in specific, so substance abuse for transgender adolescents. So according to the results of this literature review, it is apparently distressing for an adolescent to be dealing with gender incongruence, especially when they're living in a society that only recognizes gender as a binary construct of being inherently male or female. And it's something that we are now understanding that can cause significant distress. The results of this review indicate that transgender and gender nonconforming adolescents may have difficulties with these behaviors across healthcare fields and across the world. So it is important for providers to screen for these potentially harmful behaviors and help these children and adolescents gain the necessary coping skills to aid them in their journey to a more congruent gender identity. As far as future directions for these studies, a more in-depth literature review on these topics could be of great benefits. This population benefits greatly from a multidisciplinary approach to treatment, and it is important to add to this body of research to provide the best care possible. It would be interesting to compare the prevalence of these behaviors in the cisgender heterosexual population, both the adults and the adolescent and child population. One substance abuse, which is not widely studied amongst this population, is the use of non-prescribed hormone replacement medication. And it's found a lot in, or the research is showing that it's a lot in the adult population, but there's not very much on the adolescent population in particular. So to conclude, treatment for the transgender population should be considered, and we should also consider how invalidation might play a role in their suicidal ideation, their self-harming, substance abuse, their emotional dysregulation, and social difficulties. Thank you.
Thank you, Sean. Do we have any questions or comments?
Thank you so much, Sean. One thing that I think is in common with the other presentation on seeking therapy for students in doctoral programs or in master level programs in psychology, I think it's all together. This is enough of a reason and a base for you guys to advocate into receiving appropriate treatment and reduced fees and so forth. I know that in the past, we used to have the APA representative, the student representative. She advocated for those type of discounts for students, given that we cannot really treat students in our own clinic because it would be a conflict of interest for us. But I think that this is very, very important, especially because of what you're saying about suicide and so forth, and it gives you like a platform, a good platform to advocate. For example, with the Florida Psychological Association, they might be very receptive to those efforts. Thank you. Good job.
Thank you.
I think we had a question. It said, are there any additional factors you may have noticed that affected stressed transgender adolescents?
There are more, but to simplify things for myself, I just focused on these specific behaviors. So they also have difficulties with their families because a lot of families might have difficulties supporting this. They have difficulty specifically in classroom settings or in school settings. Because they receive bullying from peers, and they might be invalidated by administrators or teachers. And what I mean by invalidation is they're not recognized as their gender or their gender identity.
Thank you, Sean.
I have a question for Sean. And Sean, what a great job. Thank you, really. And such an important topic. The studies, I want to know, were these only in the United States? Were these of any other countries? I'm thinking about kids in Latin America, kids in Asia, kids in the Middle East.
So it wasn't just the US. We also found from Canada, China, the Netherlands, Germany, and Australia. I actually didn't find any Latin American studies.
Okay, thank you.
No, thank you.
So now we're going to go with cultural implications of intimate partner violence in the LGBTQ community.
So I'm Davis Dodge, and we have one other presenter, Alex Marullo. So some of the, I want to congratulate everyone else for doing a really good job, because I think this flows relatively well out of everything else that's been said. This was sort of our attempt to fight ethnocentrism and bring LGBTQ plus individuals to the front line, because it's very important for psychology to move beyond its roots of treating just white males and move forward to treating people of all different ethnicities and all different sexual orientations. So we did a systematic literature review, and some of the results were a bit, they varied from time to time about rates of IPV and whether practitioners were actually helpful for individuals in the LGBTQ plus community. We reviewed 35 articles. We took 6 out because they were not relevant. We ended up with a total of 29 articles. And we only used 2 databases. We used Google Scholar and we used PsycInfo. Anything that was older than 2009 was not applicable for the study, because we wanted to make sure we were only getting relevant data, because we don't want to go with older data. And Alex is going to tell us a little bit about the results and conclusion. I think. Okay, well, that's fine. I can continue about that. So We looked at individuals. The study was focused mainly with individuals that were trans and lesbians, as well as gays. We didn't find too many information on individuals that identified as queer, individuals that were bi, because one of the interesting methodological issues with individuals that were bi is that they meshed them in together with the gay population, so that we didn't really get a lot of that. And a few of the articles were actually didn't seem too interested on studying individuals that were queer, which is another interesting finding. Individuals that identified as homosexual had a much higher rate of likely to conducting HIV, as long as individuals that were trans. I believe the poster says it's around 48% or 48 times more likely if you're trans to conduct HIV. So a lot of the articles were really focused on HIV prevention, which was really neat because that's something that we would love to put an end to. Some of the major conclusions that we found is that community resources were very limited to a variety of individuals, particularly trans individuals, because the people run the communities didn't feel like they fit in with their biological gender, and they chose to discriminate against them, which is really unfortunate because all people deserve a right to stay away from IPV, because that's a terrible thing for a lot of people to have to go through. No one deserves to be a part of domestic violence. So unfortunately, it was much harder for them to fit in with to seek community resources. So hopefully in the future, we'll see community resources that are more focused on actually treating trans individuals. So it was also quite difficult for a lot of practitioners to connect with a lot of the LGBTQ plus populations. They were seen as not very effective a lot of times with treating the populations. There is some hope because there were other individuals that were worse, social workers, police officers, possibly because they were always pushing their agenda where practitioners appeared to be more interested in actually helping them. So it is a toss up in whether we're actually helpful for treating a lot of these populations. And that's something we really need to focus on in the future, which is why it was great that this followed Sean's presentation, because we know this is a really salient issue with everyone. Some of the treatments that were found relatively effective, of course, CBT, CBT is effective for everything, right? Oddly enough, Gestalt therapy was seen as relatively effective as well. And one of my favorite, person-centered, was seen as relatively effective. So that's pretty cool. Individuals that identify as trans had a much higher rate of PTSD, unfortunately. It was similar to individuals that were actually survived genocide, which really should speak to the importance of why we need to be continuing research on this. I think I covered pretty much anything if anyone has any questions. No questions.
I think Bjorn had a question.
Oh, wait, is it in the chat?
Let's see.
I didn't hear anything.
Hold on a second.
I am partially deaf, so.
No worries. No, Bjorn, you didn't have a question. I'm sorry. I saw your hand go up. Okay. Does anyone have any questions? This was a great presentation, by the way.
Thank you. Yes, I think this is a really relevant topic, especially. Hi, sorry, I was muted. So yes, this is a really important topic, especially as clinicians. We're going to be getting members from the LGBTQ community, and it's already a barrier to come to therapy in the first place. So also having intimate partner violence issues, we have to make sure that we're very non-judgmental. We have to not label these patients unless they label themselves. Definitely just giving them the best care that we can possibly do. And if we're not comfortable seeing them, refer them out to make sure that they get the best possible treatment that they deserve. Also, community resources are very important for us to know as clinicians to do the extra work and know what's being available. But as we know, they are kind of limited as of right now.
Did you find any information about increase or decrease in IPV? We did. It looks like, so we don't know for sure whether it's more, because a lot of the articles, I should have mentioned that, a lot of the articles, they weren't great at actually reporting that, probably because people don't really want to report that. Who wants to talk about the abuse that they've gone through? But we found that it's at least similar in rate to individuals that identify as heterosexual. So that's, we couldn't make any more assumptions beyond that. I mean, it's not assumption, it's all based on the research we found, but there were no more salient results other than that.
Yeah, also just in general, like Davis was saying, intimate partner violence is severely underreported, even in heterosexual relationships. So we will never really quite know. Another thing is sometimes people don't know what is considered abusive behavior. There's no guidebook for everyone to really understand. So it is important to educate the clients as well, even if they're in a doctor setting where they're just seeing their medical provider, letting them know what an abusive relationship looks like, what kind of actions are abusive emotionally. Sometimes people don't consider that abuse. And that's also something we found in the literature. Sometimes articles only focus on the physical and the sexual intimate partner violence, but emotional intimate partner violence is also something that's very impactful on someone's life and mental health, of course.
Oh, thank you. Appreciate the nice comments.
Thank you, guys. Yes, oh yeah, and the power control wheel, of course. And, you know, that was created in the 80s, and it's this is the woman, it's always the woman that's going to be the victim, and the male is always going to be the perpetrator. But of course, we see that that's changing. And if there's two males in a relationship, there's issues with gender norms and masculinity that have to be considered. So it's very complex. It's a very complex topic in general, but that's why I think it's so important to educate as much as we can.
And IPV is not the same across cultures either. It differs quite a bit. Like for some of the articles we found were consistently reporting that individuals that identified as gay, they had were more likely to be violent, more likely to abuse alcohol.
Yeah.
So
oh, sorry.
No, it's fine.
So I see a question from Denise. Did you find that emotional and physical abuse were significantly greater in the LGBTQ plus community when compared to heterosexuals? Well, see, again, we just don't know 100% right now. It's a very tricky subject. Some articles only talked about the homosexual relationships and the LGBTQ relationships. So we really can't make that determination if it's higher or lower compared to the heterosexual. But we do know that they experience intimate partner violence at least at the same rate, if not at a higher rate. And of course, different violence towards them.
Yeah, a few said they were lower, a few said they were higher, but most of them were consistent that it's at least the same.
Yes.
If not similar.
Yes. Yeah, I think like you guys mentioned, I know that with Alexandria, we worked on this project before and we saw how some reports said it's higher, some reports say it's lower. There's no consensus on this, which is, you know, shows how much more research we need to do on this topic.
Correct. Yes, that's why ongoing research is very important for this.
And I think
this
we have
particular
a comment
topic
of Maddie that says, you know, IPV is underreported crime, very difficult to determine which one's higher or not.
Exactly. Yes. Thank you, Maddie.
Anyone else have any questions? And Dr. Bravo added, there's literature that emotional abuse has a more enduring effect on victims of physical abuse, at least on development.
That's absolutely. Depression, anxiety, absolutely, yes.
So now we're going to go with our next topic, the influence of self-determination in organizational citizenship behavior.
Hello, everyone. Good afternoon. I'm Dr. Dodona. I am going to speak very briefly about Camilla's research project because she's on a plane and she has texted me
a few times she's not able to connect. Every time she logs in, she gets booted out. So in the IO research sequence, all of the students in a given course, and this semester we had 4, collect data together using the same survey. That helps us get a much larger sample than any one student could collect on their own. As a result, they're all drawing data from the same batch of results. This data was a convenient sample that's already been said that we collected via social media and email. The sample that we collected very much represents the students in the class. It's predominantly Hispanic, it's predominantly female, and it's better educated than the average American. And that's because the students contacted friends and family members, and the people most likely to respond to email surveys are people that know the researcher. So there's some like me bias in the collection, and that just can't be helped. It's the nature of a convenient sample. Each of the students evaluated organizational citizenship behavior along with an additional construct of their choice. Camilla was particularly interested in self-determination. And so her analysis focuses on that. Unfortunately, much like Manny's results, she was not able to find normality in her given construct. And part of the reason for that was that it was a construct that was measured with only 3 questions on a Likert scale. And so there's a limited range, which makes it much more difficult to achieve a normal bell curve in your response. She went ahead and ran the Pearson correlation anyway, although she acknowledges that she did not meet all of the criteria because she was interested in seeing what the trend would be. And she found that there was a weak correlation, although a statistically significant one, but it was rather weak between self-determination and organizational citizenship behavior. Now we have to take it obviously with a grain of salt because we didn't meet the criteria of normality, but the correlation indicates that there was a trend in that direction. And perhaps if we had a larger or more diverse sample, we would have been able to meet all of the criteria. Well, that's kind of it. I don't want to go over and over and over this. Any questions?
Thank you, Dr. Didona. I just want to just mention that in general, in personality research or personality correlates, as it is, for example, self-determination, the average correlation that you find is about 0.30. So
okay.
We're right on target.
Okay, well, that's good to know. I didn't know that. Thank you, Dr. Bravo.
I have a quick question. So why didn't she go with a non-parametric because she didn't meet the criteria? I'm just curious.
You know, I allowed the students to make their own choices about this. So, you know, the goal for me with this research project is that students experience every step of the process rather than necessarily come out with the most fantastic or tight research. And so I allowed both, you know, different students handled it differently. My only criteria was that they explain, you know, what they did and whatever their reasoning was. She was interested in knowing what the trend was. So that's, you know, why she chose to go ahead and run the correlation, even though it didn't meet it. I hope that answers it.
Absolutely. Thank you. Thank you for giving us a little insight also into your methodology, your mindset with your students, you know, what you're trying to accomplish. We appreciate that.
It is all, for me, the whole point of the project is that our students can leave feeling confident that they can conduct a survey and analyze the results. And it isn't really about, I mean, I'd love for them to be able to publish, but that isn't always the first and most primary goal. The first goal is that they get practice at what they're learning to do.
Excellent.
Okay, and now we're gonna go with our last but not least presentation, Organizational Citizenship Behavior and Gender Equality by Marietta Hernandez and Dr. Didona.
Pretty sure Marietta has had to call in. I've been texting back and forth with her. She is also not local and having connectivity issues, but it looks like she's been able to phone in, so I'll let her talk.
Marietta, you're muted, I think. You have to unmute your phone. There it is. Okay.
Hello. Are we good? Can you hear me?
Perfectly.
Okay. Well, hi. As Dr. Dodona said, my presentation, my research was organizational citizenship behavior, and my construct was gender equality, with a total of 455 participants. Unfortunately, my research, when I ran the correlation, as well as Camila's and Manny, did not meet normality. And I think we can all, know that I think it was because of the, amount of the questions that we had on the survey. For me, I had 4 questions, which did not, meet the complete, what I wanted to see, which was the correlation between gender equality and OCB. I ran as well a chi-square, and that one did meet it, but initially I just wanted, to see like the trend, just as Dr. Dodona said, and she gave us the opportunity, to choose what we wanted to get to study and know, and that's why it mostly was the correlation.
So Marietta, why don't you explain to us your results?
I think she may have disconnected.
Yeah, it looks like she's disappeared. She's also not local. She's texting me now. 1 second. She got cut off. I'm afraid she's been cut off. She does not have a good internet or phone connection where she is at this time. I think, people can see from the table that she also found a weak correlation between OCB, or organizational citizenship behavior, and our measure of gender equality. I want to make the point that the limited range, because there were only 4 items in her construct, the range is limited to 4 to 20. And when you have a limited range like that, it's much more difficult to achieve a bell curve. We had to go with some of the instruments that we used because we were limited to ones that were in the public domain or free to use, that had already been demonstrated to be valid or reliable. Unfortunately, because a big area in IO is constructing instruments, they're almost always for sale only. And so we're very often limited, much more so than in the clinical world, with the instruments we can use if we are limited to ones that are in the public domain or are free. So we picked a measure that we could use, but it had limitations.
Do we have any questions or comments? Okay, so those were our presentations. Oh, I just saw a question, sorry, on the chat box. It says, my question may be outside the scope of this particular poster. However, I'm curious about what the literature says about the organizational citizenship behavior and age. Does it decrease with age? I don't know if you can help us answer that, Dr. Dodona.
I do not know the answer to that question. It's an excellent question, and I don't know. I haven't done, I really don't know. Organizational citizenship behavior is definitely related to certain personality types. It's more prevalent in certain professions than others. But I don't know if there's a significant relationship with age.
Thank you. I'm just very curious about that.
Thank you. So now we're going to move to our award ceremony. We had early investigator awards and honorable mentions that all the presenters were eligible to win. So I'm going to turn it to Dr. Arbella.
Okay, great. So I'm not sure if I can share. No. Rita, I sent you kind of something to post on the awards so we can post them here. And before I turn it over to Dr. Bravo, she's going to be announcing the awards. We're very proud of all of you. You've done such a great job. Excellent, really. And if with your permission, we'd like to post all these posters in a space in our student success portal for the student population to see. But we're also, I'm working with the website people under student life. We're going to be listing all the publications of this year of our students. And I'd love to have a section just for the posters so that the public can see the kind of valuable work you are contributing to just our community and the greater community at large, and that you know, just the value of who you all are as emerging scholars. And so I think that's so important that people understand, not only in our immediate community, but around the country and the world, the valuable work that you're doing here at Albizu University. You're just amazing, amazing individuals. And I'm so proud to be a part of anything that you do. And so Dr. Bravo, please.
Yes, I wholeheartedly agree with Dr. Arbelo. I think that your posters presentations are impeccable, very well researched, very well thought out and presented. Bear in mind that our raters, our reviewers did this blindly, and that we had 2 reviewers completing the rating blindly. So there were some in the ranking, this is how it came out, but that doesn't take away 1 iota from the work that you all have done. You all have been magnificent, and your explanations have been amazing, and answering all questions, and we are extremely proud of you. So the first, and I'm glad that we also have something in writing here, because my printer broke at the beginning of the pandemic, and I just got a new one that I have not connected, and I had to write everything in handwriting. So actually I could call the names, but actually you can see it and we can share it. So the Early Investigator Research Award for doctoral students goes to Marulo and Dutch with the sponsor of Dr. Adila. And that particular poster is, we consider it number 8. And the name is Cultural Implications of Intimate Partner Violence in the LGBTQ Community. So kudos, congratulations. I think that you deserve a round of applause for the first prize for the doctoral group. Any questions, anything that you want to add, any of you, about this before we go with the other ones?
I just want to say thank you so much. Sorry.
You got muted there for a second. Thank you, everyone. I don't know what. Alex, you're muted for some reason. But might be having computer issues. Well,
I don't know what's going on. Okay. So thank you so much, everybody. I really appreciate it. This is such an important topic, and we're so passionate about it. I'm just so surprised. Thank you guys so much. I appreciate it.
This was really our way of trying to fight back against ethnocentrism and trying to put psychology as a science first, because we have an unfortunate history of ethnocentrism and not wanting to treat people outside of white males. So thank you so much, everyone.
And your methodology and your sponsor helped you with that methodology. It was very good. It's very, very clear. The second one is, and in no way is it second place, is also an early investigator research award, but for the master's program. And this goes to Kenya Machado. Poster, Antoni Didona was his sponsor. The poster number 3, organizational citizenship behaviors and sexual orientation. Kudos, congratulations, Kenya. If you want to say something, please do. Anyone else who wants to comment?
So much. Thank you. I wasn't expecting this, but it's rewarding, and it has been like almost like an entire year of really hard work. Thank you so much for your support. Thank you.
You're welcome. Now we go into the honorable mentions. So we have honorable mentions per program. So the first one goes to the SIDE program, poster number 5, Jorge Alsina. Are we practicing what we preach? A review on doctoral psychology students' utilization of personal psychotherapy. The sponsor was Pamela Downing, Dr. Pamela Downing. Congratulations and kudos. And so
thank you very much. I really appreciate it.
Yes, very well presented. Excellent, excellent work. Yes. Anything else that you want to say? Anyone wants to add something? Any questions?
No, thank you for the reception. Like we mentioned, I think it's an important topic, and it covers the age-old, question, who helps the helper, and what kind of resources are in place, what kind of things are kind of predict that we do seek the help that we obviously need as human beings all throughout our life.
Thank you. The second honorable mention goes to the IO program, and it's Mani Lizarazo. And of course, Dr. Tony Didona is the sponsor. And is poster number 4, does having higher independence correlate to higher organizational citizenship? So Dr. Didona, I'm not sure that the student is present.
Yes,
Manny's
I'm here.
here.
Yeah.
Okay.
Manny's still here.
Okay.
Yeah. Thank you so much for the recognition, and I want to thank Dr. Didona for the guidance, for being there pretty much for any question that I had, and for all of this, and thank you for the community, for our community, for giving us this platform and this ability to present. Thank you.
Congratulations again. And then last but not least, the honorable mention for the Masters in Mental Health Counseling goes to Barnes Vinson, and I might be pronouncing it incorrectly. And Dr. Floralba Arvelo is the sponsor, and it's Obsessive-Compulsive Personality Disorder and Characteristics of Treatment Resistance.
Thank you. Yeah, this was out of my comfort zone and into my challenge zone, my first research poster, everything brand new. So loving the support, loved seeing everybody else's, got some nice practice tips, got some good information to take home. So just loving it all. Thank you, everybody.
So thank you very much. Thank you all, and congratulations. And remember, all of you have done, completed an extraordinary work, and your posters have been very well presented, and your graphics and everything were very, very clear. Your statistics as well, your methodology. So you should be proud of yourselves, all of you, not only the ones who received the awards. Dr. Arvelo?
Yeah, I would just again want to echo congratulations to everyone. We're celebrating you, our students. You exhibited excellent presentation skills, research skills, This is the goal. The goal is to help you continue to build your critical thinking skills, your analysis skills, expand your knowledge base, and really build up your self-efficacy and your self-confidence. We want you to take these posters and please present them at the content, you know, continue to present, be bold, be brave. You know, you have it in you to go out and do this in other platforms. And so I congratulate every single one of you. And I don't know if you're all aware, I sent an email out. We'd like to print these for you as a gift. And so one of two things can happen with that. You can take it home and look at it, or we can find space for it on campus, because you know we're going to be returning to campus little by little over the next months to come, and we can talk about that individually. But I'm very proud of each and every single one of you, and I want to thank Rita and Denise, because without you I could not have accomplished this, and Dr. DePoo for your support, and Dr. Bravo and my team, the student affairs team that really is always behind all of our student endeavors. I just really want to thank all of you for all of your help and support in accomplishing our official first virtual research symposium. You are all amazing. Thank you. Dr. DePoo, is there anything you'd like to close with? And thanks to the faculty that supported our students and showed up today. Thanks, Dr. Martinez, and thanks, Dr. Dodona, for all your help and support. Nestor's here, really just our Brenda Lee, Zanetti's here. Thank you, everyone. Dr. DePoo? I don't even know if you're, I saw you on. Let's see.
Said that he had to go.
Okay, that's fine. All right. So this comes to an end. We've recorded it and we're going to be posting it as well. Nestor's going to help us post it in the Student Success Portal. I'll be in touch with all of you this Monday. Take a break, rest, stay safe. We're expecting a tropical storm, and you know, just celebrate what you've accomplished today. And again, congratulations.
Congratulations,
everyone. Stay safe.
Thank you, everyone.
Thank you, everyone.